So it's a bacterial infection, so we can treat it with antibiotics. There are two reasons to do that. The first reason is to prevent you from transmitting whooping cough to other people. And the second reason is to reduce the amount of symptoms that you're going to have. It's always helpful to give antibiotics to prevent transmission if we've diagnosed someone with whooping cough, but it's not going to make you feel better unless we're able to catch it early, really within the first 1 to 2 weeks of symptom onset, and ideally during that initial few days where you feel like you just have the common cold. And this is important because if you know that you've been exposed to whooping cough and you start having those kind of non-specific symptoms where it could just be a common cold, that's when you want to seek care early, because if we can get you on antibiotics early, we can prevent you from having all those kind of horrible complications. In terms of isolation, we're still contagious for about 5 days after we start antibiotics. And so kids are advised to stay home until they've had that 5 days of antibiotics. And then folks who work with people are at high risk for having severe whooping cough, so like healthcare workers, are also asked to stay home until they've had their treatment.